Good morning, everyone. Thanks for being here. My name is Adam Ketchmarch. I'm the CEO of the National Drowning Prevention Alliance. Thank you so much for gathering here today to bring attention and to create a unified voice around the message of childhood drowning prevention. This year, the reason we chose to throw this event together in such a quick fashion in just a few weeks, my team knows we sometimes operate like that in the water safety community, but I'm sure many of you are aware Florida's childhood drowning rate this year has simply exploded. The Department of Children and Families on their website as of this morning has 77 reported childhood drowning fatalities, and we know that there have been recent drownings in recent days. Those drownings may put this state above 80 reported childhood drownings before the end of August. Going back in DCF's database as far as we can, we have never seen a year with this high number of childhood drownings. We need to draw attention to this issue. We need to make sure we can remove drowning as the leading cause of death for children 1 to 4, both here in Florida and nationwide. This is a problem that families need to pay attention to. Many people, many parents don't understand the true facts about drowning and the way these incidents happen. 70% of drownings happen during non-swim times with our toddlers. Many parents think this is only a swim time issue. We have a great lineup of speakers here today to help draw attention to this issue. Thank you to the media for covering this event. Thank you to all of you for being here. I'm going to introduce our first speaker, who is Christina Martin of the Gunnar Martin Foundation.
Sorry, I had to write it down because if not, I'll be up here for more than 5 minutes. On a day 8.5 years ago, it started out just like any other day, but ended up turning into our worst nightmare. It's forever changing our family and our lives. In the early afternoon, we put our son Gunnar down for a nap. And that was the last time we were able to kiss him and see him alive. You see, as a curious toddler, Gunnar ended up sneaking out of his bedroom and through a sliding glass door out of the house without our knowledge, and we found him in the pool. With first responders arriving in minutes, and with police officers shutting down a major road for miles in the hopes that we would get our son just a chance to survive. We left that hospital with an empty car seat, a broken heart, and a grief that no parent should ever experience. Since the day we lost Gunnar, I've constantly been in my head about how this could have been prevented and why didn't I know that I needed to be concerned only happen in a pool while a parent is not watching, when in fact, most of the drownings happen when your child you think is supposed to be safe in your home. Parents need to hear this information on water safety from their pediatricians and family members. They need to hear this from friends and on social media. They need to hear this from policymakers and government organizations. So please, guys, today, be that person to share this information with someone. We wish so much that over 8.5 years ago, someone would have shared this with us. Thank you.
I would now like to welcome Dr. Jonathan Midgett, the Consumer Ombudsman for the Consumer Product Safety Commission. Dr. Midgett?
Thank you, Adam. I'm a child psychologist. I'm the guy in the federal government that reads the incidents and the reports from the first responders and the eyewitnesses for all kinds of consumer product related injuries, drowning included. And the federal government has put together safety tips to help prevent these tragedies related to pool and spa drownings. And they've put them together at a website called poolsafely.gov. We cover 15,000 categories of consumer products, but really the pools are near and dear to our heart because year after year, we see hundreds of incidents come across our desk. And we have to do something. We have to do it better. We have to get the message out better to the nation. There are simple steps that we can all take if we join together to prevent drownings in America. And these simple steps and the advice and recommendations have been compiled at poolsafely.gov. We have materials in English and Spanish. We have videos that you can watch with your children. We have posters that you can download and share with your friends and neighbors. And these are all available for you free of charge from the federal government so that you can enjoy your pool safely at poolsafely.gov. As we've heard, we have nearly 400 children die every year in pools and spas. It's the leading cause of childhood fatality for children between the ages of 1 and 4. It especially hits the Black community more dramatically than it ought to. We need to get the word out. This drowning problem that we face in our nation is preventable. The CPSC wants to emphasize that parents and caregivers should always designate someone to watch the water. And lots of organizations have water watcher tags that they will give out for free so that you hand this to the next person who's in line and they know they put that lanyard around their neck, they're in charge until they hand it off to the next person. It's a great idea. And there are a lot of great ideas, all of them shared at poolsafely.gov. We don't want to neglect to mention pool barriers. Keep pool barriers in working order. Maintenance is important. Self-closing and self-latching gates on all of your pool barriers is critical. And it is especially important to consider the use of an isolation fence, one that goes all the way around the water hazard in your home. And people do want to see the water. There's an aesthetic objection. People want to see the water. They don't want obstructed access to their pool, and I get that. You can get barriers that you can see right through, and they're beautiful, and they work, and they save lives. And that's another step that you can take to prevent fatalities associated with drowning. Learning to swim is a very important recommendation. Make sure everybody learns how to swim as soon as possible. And sign up at poolsafely.gov for our social media accounts, available also in English and Spanish. And learn about what supervision really means around a pool. Our goal really is to keep reducing the number of parents who don't know how prevalent drowning is. So share with your friends. This happens all the time. This happens in all sorts of families. Drowning can happen to your family, even though you maybe don't think that it would. Drowning is a very preventable injury hazard pattern.
She will be making some comments on behalf of Tori Creffy, Safe Kids Worldwide president. Michelle?
Hi, thank you so much. Today we're all here to be a part of uniting around drowning prevention. Safe Kids Worldwide has worked for 36 years to raise awareness on preventing unintentional childhood injuries and death. Our role in water safety is to meet communities where they are by partnering with organizations in order to reach more. And we also support action planning at the national, state, and local level. Our new strategic plan was launched earlier this year to ensure that there is equity in child safety. One of our key priorities is water safety. All children and families should know how to be safe in, around, and near water. Safe Kids Worldwide recognizes that drowning is a major issue, which is why we cannot do this alone. Thank you.
Thank you, Michelle. I now would like to invite Representative Robin Bartleman from Florida District 103. Thank you.
Thank you. Good afternoon, everyone. The statistics surrounding drowning incidents are not just numbers. We heard about numbers today, but they represent real lives and real families. And I want to thank you for sharing your story, because I think other parents need to hear that, and that you're brave enough to relive that, to let them know that this can be you, is an important message to get out. So on behalf of all of us, thank you for going through that for all of us today. Thank you so much. As already stated, according to the Center of Disease Control and Prevention, Florida is ranked 4th in the United States for unintentional drowning deaths among all ages. And that's the statistic from 2021. Based on the numbers today, imagine how high that's going to be. It's alarming. It's alarming that our youngest and most vulnerable are the greatest at risk. But I want to focus on a group that isn't always talked about here. And I'm going to do that because I was a special education teacher, and because I taught students with developmental disabilities. And I know firsthand that sometimes students elope. They like to run away. It's part of their behaviors, and they see that water and they have no fear. As a matter of fact, the Children's Services Council of Palm Beach County found that since January 1st, 2021, at least 63 children with autism or suspected of having autism have drowned in Florida. Imagine that. Have drowned in Florida. During that time, the majority of drowning cases in Florida involved children at least 5 years old, and those children did have autism. These findings further emphasize the need for education beyond what we give to all parents, but for those parents of children with special needs. So I am urging those parents to reach out to the Autism Society, to other groups here in Florida, to know what to do and how to mitigate those risks when you have a child with a developmental disability who will run and simply enter the water. We need to raise awareness to that, because people are not always cognizant of that, especially when they're going through so much dealing with a child with developmental disabilities and trying to get them everything they need to survive. I also want to talk about legislation that was passed this session. Representative Busada Cabrera, a colleague of mine, and Senator Hudson passed Senate Bill 544. This is a new law that establishes swimming lesson voucher programs within the Department of Health, offering vouchers for swimming lessons to families with an income of up to 200% of the federal poverty level who have children 4 years of age or younger. These swimming lessons are more than just a skill. These swimming lessons will be a lifeline for these children. And to learn more about the Swimming Lesson Voucher Program and how you can take advantage of this opportunity, please visit watersmartflorida.com. I'm going to repeat that again. watersmartflorida.com. This website will provide information on water safety and resources available to families in need. And as we move forward, we need to continue to have these conversations. Drownings are preventable. We need to raise awareness to make sure that we can prevent them from happening again. So thank you very much.
Thank you, Representative Bartleman. I'd now like to welcome State Senator Osgood to make some comments.
Hi, I'm State Senator Rosalind Osgood. I represent Senate District 32, which is a very, very diverse district. And to all of the parents and family members that have lost children to drowning, thank you for your courage and continuing to lift this up to make sure that we protect other children. As I was listening at the statistics, I began to reflect back to 1998 when I worked as the Assistant Director of Health and Safety at the American Red Cross. And at that time, we worked with the school district to get water safety into the school system. It was a priority for us. As I continue to see the data of children that are dying from a preventable death, I continue to be saddened, especially in the Black community. And we have a lot of programs. The county and the cities, we all came together and we began to deal with this issue. But then the alarm stopped ringing. It's almost a silent taboo now. And as we think about our responsibility to children, I'm a person of faith, so I believe every child is a blessing from God. I live by this acronym CHANGE. Children have a need to grow every day. And I think we have the responsibility of creating those opportunities for them to grow. And as we serve in our individual capacities, we have to level up and talk about this issue in our communities, in our churches, our sororities, our businesses. We have the power to reach others with this information and sound this alarm to help protect our children. Then we have to work with strategies that we're going into communities, doing home visits to parents that are low-income families that are not going to come to gatherings and forums like this, that might not even have internet access to go online to access some of these programs. I was very excited to support my colleague, Senator Hudson, in a nonpartisan manner in the Florida Senate to pass legislation to make vouchers available. But we can't just stop here. We have to do some type of grassroots movement to put this on the minds of everybody in our community. Because for every child that we lose a skill, we lose an invention, an idea, a doctor, a scientist. So what happens to one of us impacts all of us. I am just overly saddened to continue to lose children to such a preventable thing as it comes to water safety. So I came today because I wanted to be a part of this. I came to publicly make my commitment to help raising this issue, just like we did with the COVID pandemic, where we talked about it, over and over again. We have to talk about water safety. We have to educate about barriers for our pools, things that we could do differently to help prevent. Kids love water. It's a happy place for our children. So once they experience the joy and happiness, they don't have the cognitive capacity to understand that we need to supervise them in doing it. They're going to look for that happy place. And we want them to enjoy that happy place and not lose their life because of it. So thank you for allowing me to be here today. And let's get busy saving lives by spreading the information about water safety all throughout the state of Florida. God bless you, and God bless America.
Thank you, Senator Osgood. Before I introduce the next speaker, I would like to make a special note that Congresswoman Debbie Wasserman Schultz was unable to be with us today, but she has provided a video message. Unfortunately, given the venue, we were not able to easily share that. But the video message is available on NDPA's Vimeo account. It will be shared on our social media, and any of the media that would like it, please just see us. We'll make sure you get access to that video statement. I would now like to introduce Mike Haggard, the managing partner of the Haggard Law Firm.
Following Senator Osgood's not easy. But yeah, I'll tell you, I've been involved with the NDPA for over 20 years, been on the advisory board, and we've made a lot of progress on different issues over the years. But unfortunately, I have represented over 100 families that have lost children as a trial lawyer, which really is something to sit here and say, which is unbelievable. Should never happen. I hear Gunner's story, and I think of so many families that I represent that went through the same thing. Where the child was not at the pool. That is not the issue. We've heard the statistics. Over 70% of children drown or nearly drown when they are not expected to be at the pool. I look at Abby's Hope, and I think of Abby. And I use that example of suction entrapment, which unfortunately, I used to have a number of suction entrapment cases until Virginia Graham Baker happened. We had to lose a beautiful young girl in the state of Virginia that happened to be the granddaughter of a Secretary of State, or we would have never passed that bill. Never passed that bill. But that bill should give us hope, because what we did, what this organization did, what all those families did is they did not give up, and they basically eliminated suction entrapment. Something that I had to go through several trials knowing what was wrong, having seen the evidence, going to different organizations, knowing that these families, I know what happened to your child, and then finally we were able to do that. Through, by the way, some congresswoman from Broward County has nothing to do with Virginia and had nothing to do with Secretary of State James Baker or the president at the time, George W. Bush. So when we talk about this is a nonpartisan issue, there could be nothing more true than that. But what I will tell you is that there's two existential threats that are happening right now that I'd like to tell everybody about. One is the danger of drowning in retention ponds and canals and natural bodies of water. We've talked about barriers. We've talked about fences. We can look at the CPSC, CDC, Red Cross. I can give you every acronym I can think of that all talks about how barriers and fences work. Well, there is no duty to put a barrier around a retention pond in the state of Florida. Even though we know if we stood right in between this barrier, this body of water and this pool, we know drowning is the same. We're building a million apartments in the state of Florida. In 2023, the legislature authorized $1 billion for our affordable housing crisis. Anybody want to venture how many of those apartments are going to be built on canals, on retention ponds that don't have to be fenced at all? We have a huge problem coming. We also have an issue that's going on right now when we talk about this spike in drownings, that a number of these child drownings are happening at. It's when children come from other places to our beautiful state and they want to rent a house that has a beautiful pool. It's called short-term rentals. Right now in the United States, Airbnb and VRBO have more rooms than the entire hotel and motel industry combined. Anybody want to raise their hand and say what regulations those pools are under? None. None. It is a huge issue. I have 5 child drowning cases in my office that happened in Airbnbs. 4 of them the first night the family got there. Within hours, because they didn't have alarms, they didn't have fences. This is a huge issue. Both of these, we are going to see these numbers, I hate to tell you this, spike if we don't do something about the regulation with short-term rentals and with retention ponds. So we have to work together. We've got 2 great legislative leaders here to work with. We've got friends in Congress. This is a huge issue we all need to work on together as we go forward. And thank you to this organization and all its affiliated members for all you do. Thank you very much.
Thanks. Thanks, Mike. I would now like to introduce Dr. Miriam Lynch of Diversity in Aquatics.
Good afternoon, everyone. Wow. How powerful of a moment this is where we're all collected here together. First, I want to acknowledge the families that have lost their child due to drowning. I want to also acknowledge 2 friends of ours for Diversity in Aquatics. Kareem's mother, Arkisha, from Kareem Foundation, and also one of our programs that we've started, Dee Dee, for the Carmel Bullock and what he's meant to us as a Diversity in Aquatics family. And how powerful these families have turned tragedy into purpose here, and why each of us are here doing the work that we are doing as a part of drowning prevention and water safety. Understand that this cannot be done alone, nor in silos. As many of our speakers have spoken today, there is not just one way to prevent drownings. There are so many things that we have to acknowledge as a part of the issue and what has caused the unintentional drowning, whether it be barriers, whether it be policy, and for us at Diversity in Aquatics and what we acknowledge, also historical factors and environmental. Let's acknowledge the land in which we are at right now. This is indigenous land that is built upon and that has seen the flourishing growth that we have just heard about today. where there are more places to stay in Airbnbs and Verbos than there are hotels. Water is all around us. It is continuing to grow. Not only are we building pools in our backyards, but as the lawyer just said, there are now waterways, canal waves. There are different places where our message needs to reach to create safer communities. And that's up to us to do so. And so I do want to thank my Diversity in Aquatics family and each of the families for being here today, to spreading that message. But what I want to encourage you is to take this message and take action. Listen to communities, work with communities, partner with communities. This isn't a place where we go in and say, yes, I was just at this press conference and now I'm the savior ready to go. It is working with communities and listening to what are the needs of that communities. Because not all communities are going to come to the water, because many of them have been tragically affected because of historical policies or even environmental practices that have created the disparities we see today. There's trauma, real trauma we have to address in this space. And so by sitting and listening to communities, we create a space where we can collaboratively work together towards developing solutions to make the water safer. But guess what? Just as what was said, to create our next advocates, our next environmentalists, our next marine biologist in this space. Next, when you leave here today, what I want you to do is also acknowledge the social justice that has to take place. When you're sitting in your town hall meetings, when you're advocating for policies, make sure you're doing it equitably. Make sure that you are acknowledging the barriers that are also affecting that community. And you are voting in policies and practices that are going to equitably affect the communities in which we are trying to serve. A splash park on this side, a full aquatic center on this side. Is that equitable? Is it equitable, the policies that are for saving retention ponds and canalways on one side versus another side? Is that equitable to create safe spaces for our communities? So I urge you to go to those town hall meetings. I urge you to get behind representatives that are advocating for water safety in our communities so that we can move water safety forward and not just in this room. The next I want to say is, beyond that, work with each other and be each other's support mechanism. I wouldn't be here today without the support of many of the people that you see up here, but also the people that you see behind the cameras. Because each of these people are working in communities to make sure that they are safer. Talk to them, work with them, reach out an open hand to say, what is it that you see that I don't see in this space? Because each of us can make our community safer. Each of us can reach one, as our friend and our board emeritus, Ken Rowland, would say, reach one, teach one. And that's all up to us. So beyond this, we've got 3 steps to take. Make sure you make those steps, because that is the way that we make the change that we want to see. And we also honor the families that have been tragically impacted by drowning. Thank you.
And now I would like to introduce Casey McGovern of the McGovern Foundation and Every Child a Swimmer.
Good afternoon, everybody. My name is Casey McGovern, and I am Edna May's mother. On August 3rd, 2009, our family spent the day in the pool, just like we did many, many, many days. We really enjoyed pool time and just being outside and enjoying having a home with a pool. And our girls were, at the time, 19 months, 3 years, and 11 years of age. And we thought our home was safe. We thought that we were protected. We thought we were those helicopter parents at that time. But we also were big supporters of floaties. Our girls had floaties that matched their bathing suits, and we would take videos and pictures of them wearing those floaties and sending them to family and friends saying, look how well they're swimming. We were just incredibly ignorant and uneducated on the topic. Our family did have a pool fence, and at that time we had the one that you would have to manually lock. Unfortunately, that afternoon it was a little bit more chaotic at our home, and we spent the day in the pool. I got out first with Edna Mae. My husband got out soon after with the girls, and so I can go to the grocery store. And I went to the grocery store and checked out of Publix at 3:46 p.m. Loaded my car with groceries, drove from Publix to my house, where I unloaded the groceries, started putting them on the counter, was met in my family room by M. So I put her in a glider in the same room as me, but on the opposite side of the kitchen counter, so I could put groceries away. She loves snacks. She loves just kind of sitting there having her little, usually M&Ms or something sweet. And anyway, I got asked a question from the other room from my husband, so I walked away from her for a moment, and when I came back, she wasn't where I had left her. And so again, our house was safe, and so we thought we were doing everything right. So I went bedroom to bedroom looking at her very complacent and comfortably. I didn't realize that I should have went to the pool first. So I went bedroom to bedroom and proceeded to go to my slider where it was open. And again, before that, she was never able to open a great big slider. But that day, it happened. And I didn't even think about the pool on my radar. It wasn't until I was to this little grassy area where we had a swing set when I saw the glimpse of my daughter wearing this dress. And my world stopped. I ran around, grabbed her, and I screamed to God to help. All I did was scream and ask God to help me. Thankfully, my husband was there and heard my screams and had the bearings to do something. So he took her from me and put her on the coping and started CPR. And there was a gentleman there at the same time doing an interview, and thankfully he's like a hero because he called 911 because my brain had turned off. And he called 911 and gave the phone to me. And I remember the 911 operator saying to me, "Ma'am, you're not helping. You're not helping the situation. Put it on speaker and put it to the person doing CPR." So I did. Moments later, paramedics came in and took over, and her and I left in the ambulance. And I was at the hospital watching her fight for her life at 4:15. So when I think back at that 3:46, because we went home later on to see that receipt and all the groceries still left behind, it said 3:46. In 29 minutes, our world was rocked. Our world was broken, and it would never be the same. And that's what I urge parents to understand, is that it happens quick and it's silent. And it's just like leaving a loaded gun on your coffee table, that it's unprotected. Unfortunately, I've grown very close to Christina and Arkisha, both parents that have lost in the same manner as us. And I just found out there's somebody else, but we're here because of a horrible tragedy, but we're surrounded with other advocates that are here that are passionate, trying to fight the good fight. And I cannot thank you enough for the work that you do in helping us. And I think Miriam just spoke about working in silos. I really encourage us to stop working in silos and have a louder voice and work together so that we can have an amplified voice and we can do more and we can work together to save this. Because we talked about the number of fatalities, but we didn't even talk about the non-fatals out there that much. And the non-fatals are 8 times that, and people are impacted. And to go another step further, I'm still incredibly close with the paramedics and the first responders and the law enforcement and the hospital care, the staff that took care of our daughter. They were just as impacted. And so it's this ripple effect that not only impacts our family, but so many other people. And that's why there's a suicide rate with those professions. So we must do better. We can do better. I have been fortunate enough to accept the position with Every Child a Swimmer program, which we provide Learn to Swim scholarships to the underserved population. Any family member that makes below $50,000 a year is entitled to up to 3 months of swim lessons. We have also passed legislation in the state of Florida, Georgia, and Arkansas actually mandating all schools to share water safety information, the risk factors, and also where to go for local swim lessons. So I implore you to visit that and join us to be able to help spread that word. We talk about fire safety all month long in October, but nobody talks about water safety. And so I think that that's what we really need to do, is start really pushing that, because When our kids grew up, we talk about stop, drop, and roll, have a fire extinguisher, have these things, but nobody talks about water safety. And so I really just encourage all of you guys to have those discussions, to do more. And I just thank you all for being here. I thank NDPA for their leadership. We could not do it without you. And Arkisha and Christina, I'm with you. But thank you.
Before we close and the rain starts, I do want to give a call out to this affects so many families across this country. This book that I'm holding is from a group that works with NDPA called Families United to Prevent Drowning. Edna Mae, Gunnar, and Kareem are all represented in this book, but so are almost 100 other children. It does not have to be this way, and this is a small fraction of the families affected by drowning. It happens. It is a human problem. Drowning does not discriminate. As Casey mentioned, our non-fatal numbers, for every one child fatality, 7 or 8 have a non-fatal drowning. Some that require lifelong care. It does not have to be this way. And what my call to action to all of you is, I know you're all committed to this issue or you wouldn't be here. What I'd like all of us to do is take one action in the state of Florida, whether that's involving someone else, involving a new community, starting a new conversation to address this issue. We can save the children of tomorrow. This does not have to be our reality. You can visit NDPA.org, all of our partners, Families United, theclosetheywore.org to learn all of the facts and ways to keep families safe. But it's going to take all of us working together to break this cycle. I thank all of you for being here, the speakers on this panel, all of the advocates that traveled in long distances or short distances to be here. Thank you so much, and thank you for being partners with us on this mission.